My next guest wrote a commentary for the Star Tribune entitled, "It's Time for a Bipartisan Reset on Healthcare Reform." Senator Jim Abeler is chair of the Human Services Reform Committee, and he now joins me in the studio. Thanks for being here.
Oh, good to be here. Happy summer.
Yes, it's summer. You spoke in your Star Tribune commentary of resetting the healthcare debate. How do we reset the debate?
Well, how about having a debate? How about not having people behind closed doors setting up a bill? One of the failures of the Affordable Care Act was all Democrats and they just did what they wanted. Republicans could have learned from that and said, oh, maybe we should include a few Democrats to make a better product. That would be a big reset.
So at the national level, you would like to see the Republican Party, including the Democrats, in this debate as opposed to just doing so much behind closed doors?
Every successful, hard, big project that has been one-sided has been blown up by the people when the other side got in charge. Minnesota's great successes have been bipartisan, bicameral, collaborative approach that people know what they're doing, and they stood the test of time. We could have that model again, would work.
Well, so Democrats say that the Republicans just want health care to go back to how it used to be before the Affordable Care Act. Republicans are repeatedly pointing out the failures of the Affordable Care Act. You say both sides need to work together. And as you're saying, I mean, is this even possible?
I hope so. I think Minnesota, it could be possible, although things have moved toward the polls, toward the fringes. Healthcare wasn't in great distress in Minnesota. There were about 7 or 9% uninsured, depending on what year. Half of them could have got public programs. 2% didn't want it. So for about the sake of 2% of the people in Minnesota that had a hard time getting their coverage, we blew up the whole system. Insurance premiums have doubled, doctors' options have shrunk, and deductibles have gone through the roof. And that's not success. And so we need to there is some success in what we had before. We were nation leading in cost and quality, and our access was really pretty good by national standards. We can do that again, and people are languishing in the meantime.
There's been a lot of conversation about the difference between health insurance and health care. Where do you fall in there?
Just because you have a card that says you can go to a doctor doesn't mean you can afford the deductible. And so both parties err in the same thing. They define success as, look, you're covered. You have a $30,000 premium to get a card with a $10,000 deductible. You can't afford to go anywhere, so that card is meaningless. If you have a medical assistance card that doctors won't accept, you have coverage, but no one will take it. The card is a proxy for success. Actually, the goal of the card is to help people be healthy. How do we help people be healthy? Maybe let doctors doctor, maybe let people choose, let people understand what things cost. Like, oh, that's a pretty expensive thing. Maybe I don't really need that. If you're sick, how do we help the people who are chronically ill and through no fault of their own to get what they need? And that's where the debate needs to be.
Should everyone have access to health care despite their ability to pay?
You know, one thing about debating all these things, the more you keep your own personal opinions out of it, the better. But as a country, we have moved from the point where healthcare was something that you bought, like a house or a car, and you would earn it, to the point that people now believe, the majority at least, believe it's a right. And so, and both parties have acted upon that. The Democrats put people into medical assistance. The Republicans, being a little more clever, have tax credits, which doesn't sound like it's a gift, but it's another giveaway to people because they want to help them get it. So both sides deep down agree that we need to make it broadly accessible. How do we do that then? Let's quit fighting about if we're going to do it, but how do we go about it so that it's affordable, sensible, and doesn't reward the wrong behaviors and rewards good behaviors? Minnesota could do this. We've done it in the past.
And so what role do you see for yourself in terms of leading Minnesota towards a solution?
Well, I have 38 years in the business, and we pay for all the wrong things. Every skinny health plan includes hospital, where they pay $50 for some drug that you can buy at the store for $2. And prevention is a list of things that doesn't even prevent much. People, if you're going to build a sidewalk, you should wait till people see where they wear out the grass. We're not paying for things that people want to use that are in the alternative side. And in the true preventative side, you need medical treatment, of course, for heart attacks, but we shouldn't let the drug companies and the insurance companies tell us what health is. We should let the people who are paying cash prove what they're willing to pay for. And they're they're in droves going outside the mainstream. They're seeing acupuncturists, chiropractors, naturopaths. They detoxify. They get over cancer from some obscure method, and the system goes like, wow, that's interesting. They never asked, what did you do? There is no true science in that. And so let's listen to the people who are actually well. And Minnesota can do that. We can do that. And
so you'd like to see
challenging.
more growth in some of these alternative therapies. Would you like to see them be accepted by the, the big medical, associations?
It's funny what accepted is. So I'm going to give you a chemical that has a list of side effects this long, and it might make your hair fall out or kill you, and that's scientific. And yet something that is harmless and actually has helped 50% of the people that use it is not scientific. We're all backwards. And so we're controlled by the big money. Healthcare has become a business. The health plans, Blue Cross in particular, have become a bank trying to generate profits and control of a market. Doctors are widgets, patients are per capitations, and it's all about money for the shareholders. And really, what about helping you be healthy? What about your grandma having a chance to live as long as she can and be as productive as she can? What about people being responsible for their own health and understanding that they have choices to make? That's the direction. We've been focusing on insurance and not on health. People want to be healthy. They don't care if they have a card. They want to be well. They want to live and enjoy their grandkids and whatever. Ours are in Colorado. I would like to go there a lot. And that's what people want.
So where does personal responsibility come in here? Some people have the misfortune of being sick through no fault of their own. Others make poor lifestyle choices that end up costing a lot of money long term in terms of healthcare interventions. How does this play into the whole healthcare debate?
Maybe you thought we'd solve it all in 8 minutes today. But this is a discussion we need to have. We need to decide an insurance card is not health and that people are personally responsible. What does that mean? Well, let's flesh it out in a debate. Certainly if someone has a chronic illness that they were born with, which was through no fault of their own, we already decide we're going to help them. We have waiver programs, we have medical assistance, we have all kinds of other ways that we as a group decide. A person who makes every bad choice possible, let's discuss what that would look like. But let's have the discussion. Let's have it in the open, let's have meetings, and Minnesota could once again lead the way, and I'm eager to be part of that discussion.
Senator Abeler, thanks so much for your time today.